This is a Venapax training module. Today I'm going to demonstrate the posterior pass. The first thing after deploying the trocar is to gently dissect on both sides of the vein posteriorly to establish the plane you're going to dissect during your posterior pass. Try to dissect back to the trocar so that when you are done with the anterior pass, you can cut and pull the vein out and not have to require an Army, Navy, or vein retractor to free the vein up. It's very important to keep that score at 6 o'clock right in the middle of the vein. Again, you want to be off the vein and in a plane where you are not compressing the vein. Here I'm demonstrating just how to cauterize any potential bleeder. Again, I'm going to get right at 6 o'clock, dead center on that vein. Here I wasn't happy with how I cauterized that. Again, you always leave the blades apart when you see that little spray and you know you're making an effective cautery. There we go. Again, you want to be dead center at 6 o'clock on this dissection, which is going to leave adventitia equally on the right and left side, which will make it easier to take. Notice you just make a tiny window and you can cauterize and cut even the smallest Vasovasorum with this device. Again, notice I am oscillating the tip back and forth to reduce shear and bleeding. And remember, only use the tip to dissect out your window. And really, it's just one push above, one push below with just the tip, sometimes two. That gives you plenty of room to sneak in these low-profile blades. That window is tiny, but it's plenty of room to take the branch with. The more dissection, the more risk you could do to damaging the branch. I was a little closer to the vein than I wanted to be, so I re-grabbed it and recut it. I can't tell where that bleeding was coming from, so I just continue. And the bleeding gets magnified with the conical tip. Again, you want to just be very diligent, militant about just hitting every bleeder so you have a dry tunnel your whole case. Again, notice how I cheat a little bit to the left to stay at 6 o'clock so that I have even amount of adventitia on each side. I like to cauterize any of these little tiny arterioles or venules that could potentially bleed later on. Here I'm going to dissect that branch with just the tip. I never push past the tip with the shaft when I'm dissecting out a branch. Here I'm going to just take a little bit of the adventitia so that I can sneak in there with my blades and get the branch. On these posterior branches at 6 o'clock, I've been just pulling back after cauterizing and cutting these branches. It works well. This way the branch always stays in front of you. And you can see every time that you cut the branch. If you haven't, you just go back and cauterize a little more. And there, I just pulled back with the blades and cautery engaged and cut the branch. Notice it's just the first few millimeters of the tip to make your window. That's all you need. The fat acts as counter traction, which makes it easier to cut the branch. Again, with this device, you're just managing branches. You're really ignoring the vein. You're way off it. I'm cauterizing. Here I use the Eric Ping twist to take this branch. So anything around 6 o'clock I'm doing with the pullback, and any branches around 9 o'clock and 3 o'clock I'm doing a little bit of a ping twist towards 6 o'clock. Again, only use the tip to make a small window. That's all you need. It's plenty of room with this device. Here I'm going to do a pullback. This time I actually pulled back with the blue button that advances the blades, and I'm finding that really cuts the branch very well. So here again I just pull back the whole device, but in actuality you can just pull back the blades and it'll work. Here's a little bleeder I'm going after. I realize it's a Vasovasorum. Now again, tiny window. That took 2 tiny pushes with the tip. That's all you need. If you're used to doing your dissection completely first, this is an adjustment just to use the tip. And again, there's a little Vasovasorum. And with this device, you can take that right away. Never have to drive past it and potentially avulse it. And there, I pulled back on the blue button that deploys the blades, and it cuts it nicely. So here I have a crossing vessel, it's arterial, that potentially could cause some bleeding. So I'm going to pepper it with the cautery. Open it up a little more, pepper it some more, really get this thing cauterized so it can't bother me later. You know, the goal is to be able to close the incision right after the harvest and not even worry about any bleeding in the leg. And this device enables you to cauterize, keep the tunnel dry at all times. You notice I want even amount of adventitia on both sides. That's going to make the anterior pass much easier. Here I'm going to do the pullback again, combination of pullback and then a little bit of an advancement. All my posterior branches have been cauterized and cut. I have a nice dry tunnel and I'm ready to do the anterior pass.